Hello, and welcome to the world's first abstract-driven conference dedicated to the global COVID-19 pandemic. I'm Dr. Anton Pozniak, President of the IAS, the International AIDS Society. Today we will discuss more than 140 late-breaking studies addressing urgent questions related to COVID-19 epidemiology, prevention, treatment and care. From Iran to Italy to the United States, these studies capture critical insights from the front lines in hard-hit communities worldwide. And I'm delighted to be joined by global experts from societal and political life, research institutes, and the United Nations, who will offer their insights and analysis. In the face of this global emergency, it's no surprise that those at the forefront of the HIV response and their 4 decades of experience in dealing with a global pandemic are now also at the forefront of the response to COVID-19. It's because of this experience and the very urgent need to analyse research, review policy and exchange frontline experiences that the IAS decided to host this conference and focus explicitly on the COVID-19 pandemic. I want to thank everyone watching for taking the time to join us today when so many urgent issues demand your attention. I now have the honour of introducing Dr. Tedros Adhanom Ghebreyesus. He's the Director General of the World Health Organization that's been providing vital information and guidance to people across the globe since the first diagnosis of SARS-CoV-2. Immediately following Dr. Tedros' talk, I invite you to attend Making Sense of Science, a special session featuring Dr. Anthony Fauci from the National Institute of Allergy and Infectious Disease, the United States National Institute of Health, Ambassador Deborah Birx of the White House Coronavirus Task Force, and Professor Salim Abdul Karim of CAPRISA in South Africa. Thank you.
Excellencies, colleagues and friends, good morning, good afternoon, and good evening. 20 years ago, an 11-year-old boy called Nkosi Johnson stood up at Kings Park Stadium at the Durban AIDS conference and spoke from his heart about being HIV positive from birth. Facing huge stigma at the time, Nkosi spoke for a generation of people living with HIV when he said, "Care for us and accept us. We're all human beings. We're normal. We have hands. We have feet. We can talk. We can walk. We have needs just like everyone else. Don't be afraid of us. We're all the same." That's what he said. 20 years on from the Durban AIDS conference, we can say that Nkosi's intervention and the conference overall was a game-changing moment in the fight against HIV. I'm heartened that leaders, policymakers, scientists, activists, and civil society are assembling virtually this week to discuss both AIDS and the COVID-19 pandemic. I have been following the meeting closely, and as always, I'm inspired by the passion, creativity, and the solidarity that the AIDS community is showing. What the AIDS community has achieved over the past decades is an exemplar in itself for both the pandemic, access to health technologies more broadly, and how we build back better in the future. WHO is deeply concerned about the impact of COVID-19 on the global response to HIV. A new WHO survey showed access to HIV medicines has been significantly curtailed as a result of the pandemic, which has interrupted land and air transport supply chains. As a result, 73 countries have reported that they are at risk of stockouts of antiretroviral medicines, ARVs. And 24 of those countries reported having either a critically low stock of ARVs or disruptions in the supply of life-saving medicines. To mitigate the impact of the pandemic on treatment access, WHO recommends all countries prescribe ARVs for longer periods of time, up to 6 months, while supply chains for all medicines are fully functioning. So far, 129 countries have adopted this policy. Similarly, shortages of condoms and pre-exposure prophylaxis can prove costly, and WHO calls for countries to ensure uninterrupted prevention, testing, and treatment services for HIV. Disruptions in access to life-saving commodities and services come at a critical moment as progress in the global response to HIV stalls. While COVID-19 will impact HIV services at the very least in the near term, we cannot pretend that everything was fully functioning before this pandemic swept across the world. Over the last 2 years, numbers of new HIV infections stabilized at 1.7 million annually, and there was only a modest reduction in AIDS-related deaths. More than 25 million people now have access to ARVs, but global targets for prevention, testing, and treatment are off target. Progress is stalling because HIV prevention and testing services are not reaching the groups that need them most. Nkosi died just 1 year after his speech in Durban. He was just 12 years old, which at the time made him the longest surviving child to have been born with HIV. 20 years on from Nkosi's inspiring speech, it is an outrage that there is still a lack of optimal HIV medicines with suitable pediatric formulations. And as of December 2019, only 950,000 children were receiving antiretroviral therapy against a target of 1.4 million for 2020. Progress towards the elimination of mother-to-child transmission has also plateaued. In 2019, an estimated 150,000 children were newly infected with HIV globally, and 95,000 died from HIV. The goal of 0 new pediatric HIV infections is still far from reach. Going forward, access to services for children and other vulnerable groups must be expanded through stronger community engagement, improved service delivery, and tackling both stigma and discrimination. And like in any disease outbreak, we have seen that underfunded and overburdened health systems have a dramatic impact on other health issues. Immunization campaigns have been hit hard, risking resurgence in diseases like polio, measles, and rubella. Supply chain disruptions are impacting everything from the dispersal of bed nets to protect people from malaria to life-saving, nutritious food for children struggling with hunger. And prevention and treatment services for everything from non-communicable diseases like diabetes and heart disease to people living with TB, malaria, neglected tropical diseases have also been disrupted. If these essential health services are not maintained, there is a risk that more people will die from lack of access to health care than from COVID-19. We have seen this in previous Ebola outbreaks, and it clearly emphasizes the need to invest in building strong health systems that can withstand outbreaks and shocks. Driving toward universal health coverage is not just about health. This pandemic has shown us that ensuring quality health for all is as much about good economic practice and national security as it is about health. For too long, health has been seen as a cost. Coming out of this outbreak, it must be viewed as a critical investment. COVID-19 has again shown that the world's health system is only as strong as its weakest part, and in that vein, no one will be safe until everyone is safe. It's clear that to bring COVID-19 under control and to save lives, we need effective vaccines, diagnostics, and therapeutics in unprecedented quantities and at unprecedented speed. Learning from the impact new innovations around prevention, testing, and treatment had on HIV, WHO quickly initiated efforts to accelerate the science. The Solidarity Trial is quickly analyzing potential therapeutics to determine what works best for patients. And in April, I joined President Emmanuel Macron, President Ursula von der Leyen, and Melinda Gates to launch the Access to COVID-19 Tools Accelerator, a global initiative between multiple partners to ensure equitable access to life-saving tools for COVID-19. The principle of equitable access is a simple thing to say, but a complicated thing to implement. It requires active collaboration between governments, industry, health organizations, civil society, and communities. We know from the HIV epidemic that activists and civil society were critical to driving access to prevention, testing, and treatment. And that effort saved millions of lives, especially in low and middle-income countries. Vaccines, diagnostics, and therapeutics are vital tools, but to be truly effective, they must reach those that need them most. Getting this right, showing that the world can put aside divisions and act for common humanity, will be a critical marker for how we can come out of this pandemic. Global problems, whether HIV, COVID-19, antimicrobial resistance, or the climate crisis, need global solutions. COVID-19 has taken so much away from us, but it also provides a mirror to humanity and offers a path to solving problems now and in the future. At the same AIDS conference where Nkosi brought the audience to tears, the legendary Nelson Mandela closed the meeting by saying the following: "This is, as I understand it, a gathering of human beings concerned about turning around one of the greatest threats humankind has faced." Those words from Madiba echoed through a generation of activists and policymakers alike, and I say them today as a message to the world, repeating Madiba's words. More than 6 months into the COVID-19 pandemic, the case for national unity and global solidarity is undeniable. To beat the COVID-19 pandemic and ensure that essential health services for diseases like HIV continue, we cannot afford any division. I hope this meeting will serve to springboard greater global solidarity by increasing collaboration, sharing solutions, and accelerating the science. and above all, being kind to each other and supporting each other. I will be watching closely and look forward to hearing your recommendations. I thank you.